The clinical assessment of patellar tracking consists of 3 tests. The first is the patellar tilt test. The test position consists of the knee extended and the quads relaxed. The actual test is to raise the lateral border of the patella. A normal patella will raise between 0 and 15 degrees. The patella will be considered hypomobile if it's less than 0 degrees, which may be due to a potentially tight lateral retinaculum, the vastus lateralis or IT band, and a hypermobile patellar tilt will be greater than 15 degrees. The patellar glide test is done with the knee flexed to 20 to 30 degrees with the quads relaxed. The test consists of a laterally gliding patella. The normal medial glide should be 1 to 2 quadrants. If you have a greater glide, that means that there's a laxity of restraints. If there's less glide, it's going to be the tightness of restraints. The normal lateral glide is somewhere between 1/2 to 2 quadrants. If it's a greater glide, it's a laxity of restraint. If it's a less glide, it's the tightness of restraints. The lateral pole sign is going to be performed at 90 degrees of knee flexion. The test consists of extending the knee to full extension and observing the patella movement. The normal patella moves superiorly or superior laterally. An abnormal movement will be the patella moves excessively laterally. A radiographic assessment will be used to ascertain the stability of the patella with respect to the trochlea. We will use different views such as sunrise and sunset. This determines the depth of the trochlear groove, the patellar tilt, and the patella subluxation. Measures that we will look at include 4 different things: the sulcus angle, the congruence angle, the lateral patellofemoral angle, and the patellofemoral index. The sulcus angle is the angle that is formed by the condyles and the sulcus, which you can see in the upper left. This correlates well with instability. The congruence angle is measured by a 0 reference line that's bisecting the sulcus angle. The angular distance of the articular ridge from the line is the congruence angle. This measures subluxation. The lateral patellofemoral angle is the angle between the intercondylar line and the lateral facet. It should open laterally, which measures tilt with subluxation. And then the patellofemoral index is looking at the closest distance between the articular ridge and the medial condyle, as well as the closest distance between the lateral facet and the condyle. This measures both tilt and subluxation.